Hey everybody, Rachel Varga here. I'm a registered nurse and an advanced aesthetic nurse since 2011. In this video, by popular demand, I am going to talk about dermal fillers. Dermal fillers sometimes get a bit of a bad rap when you see celebrities and their lips are overdone, their cheeks are overdone, or their faces don't move. Different products are actually doing different things on people's faces. So sometimes things like Botox for softening fine lines and wrinkles between the brows and around the eyes is mixed up with dermal fillers. The best way for me to describe the difference between Botox and fillers is kind of like this. A cleanser and a moisturizer are both skincare products, but a cleanser cleanses the skin and a moisturizer moisturizes the skin. It's kind of like injectables like Botox and dermal filler. Botox or neuromodulators like Xeomin and Dysport also, they help to reduce the message from the nerve to the muscle, which makes muscles contract, which gives you things like frown lines and crow's feet and forehead lines. And when done incorrectly, that can make a frozen look. And be sure to watch my video on Botox because I talk a little bit more about that in that video. Getting back to dermal fillers, fillers restore lost volume and they're pretty amazing at it. As we age, we lose bone, we lose fat interfaces, we lose hyaluronic acid. So in the last little while, hyaluronic acid dermal fillers have been used pretty extensively. Brand names are Juvederm, Restylane, TOCL, and a few others, but those are really the three big ones. Dermal fillers can also be semi-permanent or permanent. The hyaluronic acid fillers are considered not permanent because your body will break it down in a period of 6 months to 2 years with something that's already in your body called hyaluronidase. If you hate your dermal filler that's hyaluronic acid based, like those three I mentioned, you can actually dissolve it with hyaluronidase, but they do still carry a risk. You can actually block blood flow with the dermal filler, leading another area of the face to not get the supply it needs, and that can result in blindness. You can also get tissue death in certain areas, so it's really important to have these done as safely as possible by an experienced provider, as they do carry side effects, as well as developing biofilm, granulomas, and allergic reactions. Although they are rare, they can happen. And a good provider is going to mention all of these to you. The worst complication with dermal fillers is actually blindness, and there have been cases of blindness all over the world. Having your lips done could actually lead to filler getting into your retinal artery, which can cause blindness. So even though you're doing an area filler on the lips, it can actually migrate through your blood vessels. Speaking of migration, fillers can even migrate up to 1 centimeter in certain areas. And when I'm thinking of botched plastic surgery or an unnatural look, what I hate is when I see a lot of clinics doing injectables like dermal fillers into the tear trough here. You'll see this a lot on Instagram with like these really quick sped up before and after photos and videos of people with dark circles or puffy lower eye bags, and what's happened is the injector has put some filler right underneath the eye bag. But unfortunately, in my experience, that's the area of the face that doesn't respond as well to injectables. In my experience, you really want to leave well enough alone with fillers around the eye area, but if you are really desperate for a tear trough filling, to seek out someone who's called an oculoplastic surgeon, because they take apart the eyelids all the time, they really understand the anatomy, and they're going to help make sure that you have the right contours. Sometimes what happens with fillers that I would consider more on the botched spectrum than overdone is when the filler has migrated and causes edema, which is kind of more on the spectrum of a side effect. Or it just wasn't placed as it maybe could have been. What happens when fillers are placed in some of the delicate areas like around the eyes is you can wake up one day 3 months to 9 months later and have horrific swelling around your eyes, which can actually look like a bee sting because there's been blocked lymphatic drainage, there's been maybe a little bit of a compromise in blood flow, and you get swelling in the area, and what happens is then it has to be dissolved. In my experience, just leave well enough alone with the lower eyelid area because it can look good for a couple of years, but then maybe 5 to 10 years later, it can start to really negatively impact the skin. In my experience with injectable and dermal fillers, that's the biggest thing that I fix for clients. But little do other clinics know is that when their client has a side effect, they might not go back to them. They might seek out another expert to help fix the side effect. So if you're an injector out there and you're doing a lot of tear troughs or lower eye bag correction or dark circle correction with fillers and you're going into the tear trough or lower eyelid, do expect clients to have side effects with it. So a way to get around this is actually to focus on the cheek, use good skincare, use sunscreen every day, get some laser treatments, and honestly the best trick for lower eye dark circles, if it's not a bag that sometimes requires eyelid surgery, is actually a little bit of concealer. Everyone has slightly dark circles under their eyes, and there's nothing wrong with it. The skin is really thin around the eyes, so it's about as thin as an eggshell. And what happens is you can actually kind of see the blood flow really easily underneath the skin. It's like with your hand, you can see veins on your hands because the skin is quite thin there and it has a blue cast to it. Concealer. Talking more about dermal fillers, what's permanent and not so permanent, the hyaluronic acid fillers will break down over a period of 6 months to 2 years. With the more permanent fillers, some of the fillers that actually stimulate your body's own ability to make collagen in an area, or silicones, fat transfers, or collagens, they carry a much higher risk. And whenever I go to conferences in Vancouver, Toronto, Las Vegas, and beyond, people are always sharing their side effects and trying to warn other injectors about these types of fillers, and that sometimes they are great and you can get a great outcome, but they do carry more of a risk. I don't know about you, but I like the idea of something being more temporary and then you just kind of keep topping it up over time. When you see messed up celebrities or people that have had botched plastic surgery, a lot of times they would have had inappropriate products in certain areas. There's one woman, unfortunately, who decided to inject cooking oil into her face. Clearly she's mentally unstable. This is not something that normal people do, and that can have life-threatening consequences. Always seek out expert guidance from an expert provider. Ways that I can recommend that you avoid looking overdone with your dermal fillers is to actually look at who's doing your procedure also and the people that work in the clinic. If you say have friends or family in your city that are looking good and they're going to a specific clinic, go there. If you have met or encountered people that have crazy lips or crazy cheeks and they're going to one clinic, maybe don't go there. Always make sure that your treatments are looking natural and not overdone and are staying in those ideal facial proportions. If you look at Nefertiti, she's kind of the ideal of beauty, and she has been so for thousands of years. So look at the contours of her face and see what you like about that. And if something with your facial proportion is not in alignment with that, that's okay, because you can still be beautiful and have different facial proportions and features. But it's my job when clients come to me to help them become as attractive as possible. So I use that as a reference and see if, oh, there's been some volume loss in this area, or there's been some volume loss here or here. We can do some softening with dermal fillers and it works really, really well. That's kind of an overview of how to avoid botched plastic surgery or looking overdone with dermal fillers. Is the biggest take home is to find a provider that looks natural themselves and is really knowledgeable on different products and procedures, has ongoing training, and isn't really doing the Groupon or the big sale route, things like that. That can actually be a red flag in and of itself. Never look for the cheapest option, and always look for products and procedures that have been around for at least a decade. That's a pretty good rule of thumb, is that if people have received certain products like hyaluronic acid based fillers, they've been around for well over a decade now, and people are having great results with them, that's a good indicator because there's research to back up that they are considered safe procedures. But with everything, there's always a risk of side effects. Always check with your doctor if these treatments are right for you. Thank you so much for watching this video. I'd love to hear from you in the comment section down below if you have questions about dermal fillers or how to look natural, how to age well, all of that. Nothing's off limits here. Let me know what your questions are. Don't forget to head over to rachelvarga.ca and continue the conversation over there. I have a ton of free resources. I'm all about helping people make the smartest decisions to enhance their inner and outer beauty together. And just a little side note from me that is actually the most important thing about this is to make sure that your body, mind, and spirit is as close to alignment and balance as possible, because in my experience, when people are more balanced in those areas of their life, they are actually more beautiful. So don't look at receiving plastic surgery or cosmetic procedures when you're not already in a really good place yourself in regards to your body, mind, and spirit. You should always do some inner work before looking at getting procedures, because sometimes I'll meet with people and you can kind of tell they're unhappy and they're wanting to do things to make themselves look better, but really they have to do that inner work first. Finding a provider that will guide people in the right direction for that is really step one. See you in the next video, guys.